Along with HDL and LDL, doctors monitor molecules called triglycerides during routine checkups and lipid profile tests. A triglyceride is a type of fat used to store energy and then transfer that energy to different muscles in the body. Typically, a small amount of these molecules are found in the blood. However, when triglyceride levels get too high, there is a major risk for heart disease. Patients can lower their triglyceride levels by changing their diet, doing things such as limiting the foods high in fat and increasing their fiber intake. By doing this, patients can cut their triglyceride levels in half, improving their overall quality of life. When a patient goes and gets a lipid profile test, a test that shows all cholesterol numbers, the results come back in 4 different groups: total cholesterol, HDL, LDL, and triglycerides. Here's how to interpret the numbers on your lipid profile test. Total cholesterol, high risk would be considered 240 milligrams per deciliter and above. Borderline high risk would be around 200 to 239 milligrams per deciliter, and normal or your desired level would be less than 200 milligrams per deciliter. LDL levels, 190 milligrams per deciliter and above, is considered to be high risk for heart disease. Less than 189 milligrams per deciliter means you're not at risk. HDL levels, high risk will be less than 40 milligrams per deciliter. Triglyceride levels would be 500 milligrams per deciliter and above would be very high risk. High risk would be 200 to 499 milligrams per deciliter. Borderline high risk would be 150 to 199 milligrams per deciliter. And normal would be less than 150 milligrams per deciliter. When analyzing your results and figuring out what the numbers mean, make sure to look at all groups of information. Just looking at your total cholesterol doesn't mean you're off the hook. HDL and LDL levels are major indicators of heart disease, so it's important to know these numbers as well. Changes to LDL and HDL levels are all about lifestyle change. Exercising frequently, whether it's running a marathon or walking the dog, is a huge part of preventing heart disease and lowering cholesterol levels. Diet is also a huge factor. In order to lower LDL levels, you need to limit the amount of saturated fat intake, try to avoid trans fats, and increase daily fiber intake. Some cheap, easy-to-make fiber-rich foods could include oatmeal, strawberries, and apples. Losing weight will help tremendously in raising HDL levels. Being smart about what you put in your mouth and maintaining portion control could be the difference between a good doctor's visit or a bad one. Avoid high-sugar food or drinks, and increase your intake of seafood. Even if you're allergic or just don't like it, many stores provide omega-3 supplements or gummies that you can take in place of eating the seafood. Consuming omega-3 is another way to increase HDL levels. Being aware of which fats lower what regarding cholesterol is a really good way to keep your risk for heart disease low. Here are some facts about the fats in everyday diets and the effects that they have on health. Because the body produces LDL cholesterol naturally, eating foods high in saturated fats increases the risk for heart disease because there is too much LDL cholesterol in the body. By limiting foods high in saturated fats, such as beef, lamb, and dairy that contains 2% milk, the risk for heart disease decreases. The American Heart Association recommends eating no more than 6% of saturated fats daily. Trans fats can be extremely harmful to the body. These fats are also called partially hydrogenated oils, meaning that hydrogen was added to liquid vegetable oils to make them solid. Eating fried or baked goods frequently raises LDL and lowers HDL, increasing the risk for heart disease. However, there is a substitute that you can use in place of the saturated and trans fats: unsaturated fats. Unsaturated fats are extremely beneficial in lowering cholesterol. They can be found in fish, avocados, and vegetable oils like canola oil. By eating these fats instead of the trans and saturated fats, you can enjoy great tasting food without having to worry about the consequences. Hope you learned more about cholesterol. Happy eating!
Created using Powtoon.